Fernandez Baraza, the deputy, the Honorable Ayub Savula, the whole team of the county government, His Lordship, the Bishop of Kakamega, the PS Medical Service, and the whole team from SHA and Digital Health Agency and the Ministry of Health. I think today we have come to Kakamega as part of our engagement with our county government, who are the backbone of the health care delivery system in our country, because the counties, since you know health is devolved, they are the ones who run level 1, 2, 3, 4, and 5 health facilities, majority contracted by SHA in our country, alongside the faith-based and alongside the private health providers. First, I want to thank the Governor Baraza. Governor Baraza is one of the progressive governors and leaders, particularly on health matters, because I can give a scorecard. I've been to many counties, and there are many I'm going to visit, because he knows his facts very right. In our engagement this morning, he knows what the Kakamega General Hospital is doing and the engagement with us. He knows all the level 4, the 15 of them, and their engagement with us. And he knows the primary healthcare facilities and their engagement with SHA. And his numbers and our numbers tally. And I have said earlier, we have a very watertight, solid system. And I want to tell the people of Kenya from Kakamega here that we are not playing games. We are ready, willing to answer any question. And that is because of the system that we have built. So it can detect fraud, and we have explained so well, even to Governor Baraza, and those people who work in his facilities and who think they can steal the county commodities, the drugs. You can only do it in the next 2 weeks. We are using and helping him with our system that you cannot steal a Panadol from any public health facility run by the county government of Kakamega. We have agreed with him by the next circle, this Friday, and the 14th of September, which is the day we pay, SHA pays, we will pay him 100 million shilling, and all the other balances remaining, we have agreed with him why and how they will be verified and how they will be paid. On St. Mary's, I want to thank His Lordship the Bishop on coming and discussing. You have heard from him since inception, December. SHA started in October. Since December to August this year, St. Mary's Hospital has received reimbursement from SHA totaling 98 million Kenya shillings. And the man of the clock, the bishop, is behind me. And I'm a very true and believing Muslim. So we don't lie, me and him. Me and him, we might be two different faiths. The way I have a lot of respect for the religious leaders across our country. So we have paid 98. And we are paying him before next week, before 14th. In fact, we start paying him on Friday, his balance. And 14th, when the circle is being paid, money amounting to 14.3 million. The other balance, we have shown him how we are going to verify with him. So, St. Mary Hospital, from where we sit, has not been closed by SHA, has not been closed by the regulator, Kenya Medical Practitioners and Dentists Council. Their license is valid, has not been closed by the Digital Health Agency that controls the system. So from where we sit, St. Mary Hospital has all the valid licenses from all our agencies. So those who are peddling in FINROS and want to use St. Mary, I am telling them here from Kakamega, this weekend you better look for something else. St. Mary is not available for you. We have resolved it. And Bishop, when you open, I will come back. I will come back and I will come back with the drugs. I will come back and we do a medical camp. We want to help the people of St. Mary's working with the church. Because our business is to make sure that we deliver accessible, affordable, quality health care to the people of Kenya within our borders. So those who are, whether they use the floor of the house, whether they use funerals, I don't know, Governor, whether they must look for something else. Because St. Mary's story is closed. And thank you, our Lordship, the Bishop. And we will make sure, and today the Bishop is very happy. We have taken him through our system. We have taken him through how SHA deals with the claims. And we have taken him how we should go forward on the pending bills of NHIF. And I want to make it very clear. The pending bill of NHIF are in two categories. And this pending bill of NHIF is why we had to close NHIF and start SHA. Because it was a den of corruption. It is where patients' money was being stolen, where people were building their wealth using patients' money. And it's immoral and unconstitutional, and we will not allow it going forward. So, anybody with a pending bill of NHIF from 1 shilling to 10 million, totaling 5.3 billion, accounting for 92% of the entire NHIF bill, as a government, on the direction of the President, we will pay in the next 2 months. We are only waiting for the National Treasury to introduce the supplementary budget, and we put the 5.3. Anybody who has more than 10 million, we have agreed that we do verification. I formed an independent team to verify that pending bill outside the Ministry of Health. The same crooks and fraudsters, because they know that the bill of theirs, some of the bills are fraudulent, are fraud. They went to court, they stopped me and the committee from verifying. A court of law has given judgment that what I did was unconstitutional. I agree with the court, but I want to say the same constitution under Article 203 and 202 and the Public Finance Management Act obligates me as a public officer to protect public funds. So if you want me to pay you, you must be ready to verification of those pending bills. So I'm calling upon both faith-based, government, and most of them are county governments, including my own referral hospitals, like Kenyatta Hospital, our own referral hospitals, Kenyatta Hospital, MTRH, Jaramogi, Oginga, Kenyatta University, Madare, and faith-based and private. We're telling you, let us come to the table and I'm going to, working with the PS, we will form a team to verify. Minus verification, we are not going to pay money. We must protect public resources. So that is about the pending bill, the NHI pending bill. So thank you very much, Governor. I think I really want to thank you and your team and the Bishop for clearing the air. St. Mary has confirmed, the Bishop has confirmed that they have received 98 million from SHA, and they receive it on a monthly basis. They have a problem with the pending bill, and going forward, we'll work together to make sure all our faith-based, all our public hospitals, and SHA and DHA and the ministry work together, because we are all working for the people of Kenya to make sure that each and every Kenyan gets the right health care, regardless of his social status. And that is what this government promised, that healthcare delivery must be equal for the rich and for the poor, for the mighty and for the person at the bottom. So that is our message. So tell my friends, some of them are my very good friends, politicians. I know them, and I've been sending them. Bishop, what I have been sending you, I've been sending to these politicians. But you know, because they have no agenda. They have no agenda. Na mimi nataka niseme, mimi unajua nimekuwa mzee. I have been in parliament for 20 years with most of the leaders. My business is to fix the healthcare sector. My business is to fight fraud. Na wananchi mkiona mahali kuna ukora, hata dawa ya hospitali inaibiwa, unapiga 147. Jana mimi nilikuwa call center ya 147. Na nimesikiza Wakenya wakinipigia. Ukienda kwa public health facility, ile ya dispensary, health center, sub county, outpatient, it is free. But you must register with SHA. Usiende kwa hospitali ya governor, useme ati waziri na rais wamesema ni free, na hujaregister na SHA. Ni free wakati uregister, na tafadhali register ili governor akutibu, uende nyumbani, ama magavana wa kutibu, ama St. Mary kutibu, uende nyumbani, ili hawa pia wapate hiyo pesa kutoka SHA. Na tumesikizana, governor ataweka desk. Wewe ukiingia kwa hospitali unaulizwa umeregister na SHA. Kama hujaregister unapewa ID card. Kama ni wewe mama hujafikisha umri ya ID card, tunakulipia bure. Unakuja na birth certificate. Teenage mothers, you just need to go with the birth certificate. Maneno yetu ni wazi. Si atufiti kitu, si tumekuja St. Mary's. Si kulikuwa na uongo hapa ya nini. Hata wengine wanasema ati Duale ni corrupt. Na wale wananiambia corrupt. Nimeserve now parliament. I can write another book about them. Wale wanasema ati Duale ni corrupt. Mimi si mmoja nimeandika kitabu. Huyo anasema Duale ni corrupt. Na Masi ni corrupt. Na PS ni corrupt. Huyo we can write a book about him. Ya, na unajua hawezi kutisha sisi. Ya, waambia usititishe na ukiwa syndrome. Tumekutumia. I have sent him. And he knows himself. I have sent him. I have sent him what I have sent the bishop. I have sent him what I have sent the governor. Lakini yeye hataki kusikia. So mwambieni Duale amesema niko Kakamega. Na kutaka next time tutakutana kwa syndrome. Na next time tutakutana kwa mkutano, huyu atanialika governor. Na tunapatana hapa kumundu. Wewe kuja na hesabu yako, mimi nakuja na hesabu yangu. Sawa sawa? Asanteni sana.
Discussion this morning, the focus was on the pending bills for SHA for Kakamega county facilities with regard to level 2 and 3s, level 4, and then of course level 5. For Kakamega County, we have a total of 293 million shillings, which are pending bills for SHA, comprising of 72 million for level 2 and 3s, 55 million for level 4s, and 166 million for level 5, that is CGH. And I'm happy to report that we've had a very fruitful meeting, and the SHA team has confirmed that in the next 2 weeks, they'll be disbursing 100 million with regard to the pending bills which relate to our level 5 facilities, as well as an analysis of what is pending for level 4s that are 15 in number and level 2s. I know our Lord Bishop will give the story of St. Mary's for purposes of just making a clarification, but I want to take this opportunity in a special way to thank the Ministry of Health, because out of the claims which were submitted from our facilities for level 3s and level 4s, we have so far received level 2 and level 3s, we have received 75 million Kenya shillings, and what is pending is 72 million. For level 4, we have received 119 million. What is pending is 55 million. Level 5, which is CGH, we have received 250 million, and what is pending is 166, and the first 100 million will be received by the 14th of this month. I want to, in a special way, thank the ministry for making sure that this SHA registration is rolled out in Kakamega County, as well as honoring the claims which have been submitted, because the claim submission before the payment is done, there's a verification process which has basically been ongoing. So with those few remarks, I want to invite the Lord Bishop, Reverend Joseph Obani of the Catholic Church, Diocese of Kakamega, just to give a brief statement with regard to the claims that have been paid for St. Mary's, what is pending, and what we have agreed with the ministry. Then finally, Waziri will summarize the conversation. So karibu sana Baba Askofu to talk to the media. Karibu.
Thank you very much for the opportunity to address the media. Honorable CS for Health, His Excellency the Governor, and all the officers, and especially the Ministry of Health. I wish to express our gratitude to the CS and the team of the ministry having visited us so that we can understand how we move forward and where we are. And I'm glad to tell you that we have had a very fruitful discussion, and we have understood where we are, what's our position. We have had the problem with St. Mary's Mission Hospital, Mumias, whose functions had been on suspension on account of the strike of the workers or the staff, and therefore the function couldn't continue because of the salary arrears that they have incurred for 3 months. And that one, we believed that we got the payments that are due from SHA, we will have sorted them. So we've agreed, and I confirm that so far from December of 2024 to August of 2025, the SHA has disbursed a total of 98,671,567. These have been disbursed across, spread over the months that we have had. We have, believe, a pending payment of 35 million claims, 5 million that we expected from SHA, and that's what we believe that will help us to be able to clear the arrears of the workers. And we are also receiving information because of the verifications that have to go on, that 10 million of the claims have still to be verified. So it means that we have to continue engaging with SHA, but I can confirm that we have had all the money. The genesis of the strike of the workers came because of the accruing arrears from NHIF, which is about 143 million. But now we are talking about what has been dispersed by SHA. And I can confirm that each month SHA has always dispersed its money, and the pending claims is what we have negotiated, and we have agreed that once other documentations are submitted, then we believe in the coming 1 week we may receive about 14 million, and that is able to help us to be able to engage the workers to return to work so that the people can be served. We want to thank the ministry for having made this effort to come, and I believe the idea of SHA, because of reaching out to all the patients, is a good idea that, well implemented, is going to benefit the Kenyans. As I have also noticed that they are paying promptly, though not all the claims that are paid, but they are able to help the patients. And listening to the CS and his team, you can tell that there is goodwill, and we believe together, when we are cooperating together, there will be greater effect in the work of the service of the people of God that is in matters of health. So I wish to reiterate that we are ready to collaborate and work towards the good of the people that we are called to serve. Thank you very much, and God bless you.